Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Secondary dysmenorrhea or congestive dysmenorrhea. In secondary dysmenorrhea, already the patient has a pelvic pathology being present. So there will be endometriosis is the most common cause of uh, secondary dysmenorrhea. Adenomyosis and fibroids are also the other causes. Patient will be a female in reproductive age group more than 30 years with complaints of pain during the menstrual cycle. It is present for the past few months. Pain occurs much before the onset of menses and pain remains even after onset of the periods. Pain is congestive in nature and intensity of pain keeps on increasing, that is progressive dysmenorrhea. Pain is localized. Dysmenorrhea may be associated with dyspareunia or dyschezia.
thank you and thank you for watching.